I'd like to welcome you to the first talk on Transesophageal Echocardiogram basics. This is going to be a 5-part series where we're going to talk about the ASE guidelines, indications, contraindications, and complications. Our second talk is going to be how we consent the patient for a transesophageal echocardiogram. The third talk is the use of moderate sedation and how to set up a room. The fourth talk is on tips for intubation. And the fifth talk is actual advice and obtaining the necessary basic images and tips for improving technique. Each of these talks is geared towards fellows on the basics of transesophageal echocardiogram. I'll have separate talks on structural transesophageal echocardiogram for each procedure as well. So to get started, I would highly recommend reading these guidelines by Rebecca Hahn et al. This is extremely useful when understanding how to go about doing the procedure. So check out these guidelines from the American Society of Echocardiography. So my basic recommendations, as with any patient that you're going to be doing a cath or a procedure on, you need to understand why the procedure is being done. So for instance, if this is for pre-Watchman or severe mitral regurgitation, you want to make sure that you have all those dimensions for the implanting provider. So also, is this appropriate? Oftentimes we'll get calls for a transesophageal echocardiogram for infective endocarditis, but the transthoracic has not been done yet, and oftentimes you can get the information from the thoracic images. I always ask these questions for each of my patients is, have they been NPO for 6 hours? Have the 2 feeds been off for 6 hours and checked for residuals? Always ask if there's false teeth, dentures, or loose teeth. Make sure that these are out before the case. Do not rely on nursing or anesthesia to do this for you. I always ask about medications or specifically about sedation problems with prior procedures such as EG or colonoscopy. And then when I ask about difficulty swallowing, I use the question, does steak or chicken ever get caught in your throat when you swallow? You'd be surprised on how many patients have esophageal stricture, which is one of our contraindications for the procedure. So indications for transesophageal echocardiogram is basically we weren't able to see certain structures on the thoracic surface images well. So oftentimes these are structures closer to the posterior portion of the heart or the esophagus. So the interatrial septum, left atrial appendage, and valvular structures as well. We can use this for intraoperative TEE and then for critically ill patients. So contraindications for TE, we touched on this briefly. Esophageal stricture is one of these. Esophageal tumors, perforation, laceration, active upper GI bleed, and then those anchors or esophageal diverticulum. So for these patients, they need to have an EGD prior to you doing the procedure. Oftentimes you can do it at the same time. So I will have the gastroenterologist dilate the esophagus, and then I'll come in right afterwards and we can do it all, and the patient only needs to undergo sedation once. Relative contraindications are recent upper GI bleeds. Oftentimes we can say, well, let's stay out of the stomach because that's recently where they found the bleed, and we'll stay within the esophagus. Esophageal varices, we'll talk about that as well, but I tend to do the procedure if they have stage 1 or stage 2 varices and a recent EGD, and then if they have significant coagulopathy, these are also relative contraindications. So the risks of complications with transesophageal echocardiogram is super low. So I quote patients a 1 in 1,000 chance of severe complications such as esophageal perforation, bleeding, mortality. But most of the issues come from around relative dysphagia, some hoarseness, oral trauma. These are more common. And you need to be careful with your bite block so it's not pinching the lip during the case, and oftentimes patients do just fine for this procedure. Please see my next talk on consenting the patient.